When I started gaining the weight, of course, it's very discouraging. It's very hard on you when you look at yourself and see that.
Tanza Killebrew-Layden has decided the time has come to do something about her weight.
I am already a diabetic and have high blood pressure. And then my sister, who is 4 years older than me, had her second heart attack and her second stroke. So I knew I didn't want to go that route. So I knew I had to do something.
Do you have any other questions or concerns for me at this
So Tanza came here to the Emory Bariatric Center, a place dedicated to helping patients treat their obesity.
The idea and the philosophy is to be very comprehensive. We involve psychological support, we involve medical and nutritional counseling and monitoring, and then we offer surgery for those people who want to go that route as well.
Protein is going to be extremely important.
For Tanza, surgery was the answer. She's preparing to undergo a procedure known as a gastric bypass.
What it does is it creates a very small pouch with your existing stomach, and I tell people it's really the size of your thumb. That is your new stomach. With that, it restricts the amount of food that you take. We also rearrange your intestines so that this pouch empties directly into the intestines, and that induces malabsorption. So maybe more than 50% of what you're taking is not going to be absorbed.
The gastric bypass is one of 3 surgeries offered at the Emory Bariatric Center. We also offer a gastric banding system in which a restrictive band is used to reduce the size of the stomach and help patients limit their food intake. Another option is called a laparoscopic sleeve gastrectomy.
What we do in the sleeve gastrectomy is that essentially we remove the reservoir portion of the stomach and create a gastric tube, a very thin tube, which really works by restricting what you can eat.
Surgery isn't the only option. The Emory Bariatric Center also offers a non-surgical approach to weight loss.
The main program that we have here at Emory Bariatric Center is our OptiFast program.
Regardless of the approach, results can be dramatic. Patients lose weight quickly, but perhaps more importantly, medical issues associated with their obesity get better as well.
So a lot of people come to us with arthritis, diabetes, high blood pressure, and the most wonderful and gratifying thing about it is to see those problems just melt away as they lose the weight.
But dramatic changes like that are the product of far more than just surgery.
What I tell patients when I see them in the office is we're about to start a marathon, and the beginning of the marathon is really the surgery. And so what's required to be successful long term is not only a good start, but you have to have good support all the way through to reach your goal.
We know that they have a good taste.
Patients consult nutritionists, psychiatrists, and health fitness instructors. We also provide ways for patients to encourage each other as their lives change.
They are actually the best support for one another because they are going through this. Their bodies are the ones that have experienced the operation. And one of the nicest things to hear are stories like that, where people are able to talk to one another about how different they feel about life and how their outlook has changed.
Emory's long-term interdisciplinary commitment to patients has delivered outstanding results. Results that have earned the Emory Bariatric Center accreditation as a Level 1 Center of Excellence by the American College of Surgeons.
I think it was worth 100% having the surgery.
Florence McSween is one of those patients for whom life has changed completely. 6 months ago, she came to the Emory Bariatric Center overweight and suffering.
I couldn't walk very much, I couldn't stand very much. I had to stay home, and I pretty much during the day would stay in my recliner.
Florence underwent a laparoscopic sleeve gastrectomy, and 6 months after her surgery, life is very different.
Most patients will refer to bariatric surgery as their new birthday. They learn to eat differently. They learn to eat a different pattern.
Now, instead of 3 big meals a day, Florence eats several small and carefully chosen meals. But with the small meals have come big new opportunities.
We're gonna come walk? Yeah.
Now Florence can shop, walk, get outside to work in her garden, all things that were difficult at best before.
It has made a tremendous difference in my life. I'm not a prisoner in my house anymore.
If you think the Emory Bariatric Center can make a difference in your life, call the Emory Health Connection at 404-778-7777 or register for one of our free bariatric surgery seminars.